All right, let's move to the next slide, please. One more. All right, welcome everyone. My name is Aaron Green. I have the privilege of serving as the Department of Healthcare Policy and Finances, Health Disparities and Equity, Diversity and Inclusion Officer with the department. And first and foremost, before we dive into this incredible 2-hour session, I wanted to make sure that we ground ourselves in a land acknowledgement. So the question is, for folks who might not be familiar with a land acknowledgement and its practice, why do we recognize the land? And so it's important to recognize the land as an expression of gratitude and appreciation to those whose territory we reside on. It's a way to honor the indigenous people who have been living and working on the land from time immemorial. It is important to understand the long-standing history that has brought all of us to reside on the land and to seek to understand our place within that history. I also always want to make this statement that a land acknowledgement does not exist in the past tense or historical context. It's important to recognize that colonialism is a current ongoing process, and we need to build our mindfulness of our present participation. It is also worth noting that acknowledging the land is Indigenous protocol. I'm seeing in the chat, I can't hear anything on my side. Can I get a thumbs up that folks can hear me overall? All right. Just to move forward with the land acknowledgement, we would like to acknowledge that what is now Colorado includes the lands of the Ute, Arapaho, Cheyenne, Dene, Lakota, Apache, Puebloan nations, and many tribes, and that the sovereign tribal governments of the Ute, Mountain Ute, and the Southern Ute Indian tribes still reside in the state. These tribes are the original stewards of these natural areas. We want to take a moment to honor and respect these original stewards of the environment and their relationship with the land. Next slide, please. So I want to make sure that we do a quick introduction of our internal HCPF staff, and I will start with Bonnie Silva.
Great. Thank you, Aaron. Good morning, everyone. My name is Bonnie Silva, and it is my honor to serve as the Director of the Office of Community Living within Healthcare Policy and Financing. I identify as a cisgender Caucasian female. I'm in my early 40s. I have fair skin, shoulder length, light brown hair. I am wearing black rimmed glasses with clear lenses. I have in my large gold hoop earrings, and I am wearing a cream sweater with gold flecks. And I am sitting in my home office.
Awesome. Thank you, Bonnie, for the reminder of doing a physical description. So I'll circle back to me really quickly, and then I'll pass it over to Tamara Keeney. So I'm Aaron Green. I identify as African-American cisgender male in my mid-30s. I have short black hair. I have black rimmed glasses with clear lenses. I have facial hair. I am wearing a gray vest with a white dress shirt underneath with a gray and black tie, and I'm also in my home office. So we're doing a physical description for anyone in the audience who are blind or low vision impaired. Thank you so much. Tamara Keeney, you're up.
Tamara Keeney. I am the Research and Analysis Manager at the department. I'm a white female with brown hair up in a bun, wearing a pink sweater. I'd also like to take just a moment to acknowledge 2 other individuals from the department on this call who are really instrumental in putting together the data that you'll see today. So thanks to Leanna Major and Marley Fitchner, who are also joining us. I'll pass it to Tasia Sen.
Hi, everyone. My name is Tasia Sen. I'm a white woman with blonde hair and glasses, and I'm wearing a blue flowered shirt. I'm a senior policy advisor here at the department working in the Office of Community Living, and I am the project lead for this ARPA project we're talking about today.
Hi, everyone. I'm Jennifer Larson. I am a cisgender Caucasian female in her mid-40s. I am the training specialist for the Office of Community Living and helping with facilitation of today's meeting. I am wearing a black shirt with white flowers on it and sitting in my home office.
Hi, everyone. My name is Haley Gleason, and I serve as the department's Economic Recovery Officer, as well as the Strategic Outcomes Division Director within the Office of Community Living. I am a Caucasian female with brown hair and blue eyes, and I am wearing a black dress with a gold necklace.
All right, thank you so much. And Jack, I will turn over to you.
Thank you, Aaron. I'm Jack Becker. I identify as a white heterosexual male in my mid-30s. I have short curly hair, brown eyes, and wide-rimmed glasses, wearing a button-down shirt in my home office. And as we continue our introductions, I would invite each of you that are with us today to chat a few words about who you are and where you are, and anything to describe yourself. The Civic Consulting Collaborative, along with our partner CREA Results, is pleased to be working with HCPF to engage trusted voices in our communities toward creating equitable access with Colorado's home and community-based services. The collaborative is a unique member-owned cooperative, and our consultants help navigate challenging social and environmental issues by ensuring community is at the center of systems change. We've worked recently on Colorado's behavioral health transformation, and our team has significant experience working across the social determinants of health to bring government, resource providers, and service users in our community together. CREA Results has long worked to ensure health equity in Colorado, with a focus on immigrant and Latino communities by working through their well-regarded Promotores de Salud community health worker model. I'd now like my colleagues, Amy, Rashawn, and Fernando to introduce themselves. Amy?
Thanks, Jack. Hi, everyone. I'm Amy Engelman. I'm a white cisgender woman in my mid-40s. I have long brown curly hair, green eyes, and I'm wearing an oversized comfy gray turtleneck sweater in my home office in what appears to be snow light weather now, which is great. I'll pass it over to Rashawn.
Good morning, everyone. My name is Rashawn Bliss. Good morning, everyone. My name is Rashawn Bliss. I am a cisgender African-American male in my mid-30s. I've got brown skin with freckles and curly black hair, black rimmed glasses with clear lenses, a bit of facial hair, and I'm wearing a black V-neck sweater, and I'm sitting in my home office. And I'm really happy to be here supporting all of you and the summit today. And I am here. If you have tech issues, you can go ahead and direct message me or click the top three, the little three buttons in my square and send me a message, and I'll see if I can help you out.
Good morning, buenos dias, everybody. My name is Fernando Pineda, and I am the director of CREA Results. I asked my kids to help me to this description. So they say that I am a Mexican father of 5 kids. At 5'8", I still stand taller than them. I am brown skin and thick eyebrows and a mustache and beard speckled with white hair. And most of the time I wear a silly sombrero that looks like a fedora. And today I'm wearing a black shirt. Great to be with you today.
Thank you so much. Next slide, please. Thank you. Again, my name is Jack Becker. We want to ensure we are keeping everyone's wellness at the center, and we are relying on each of you for your support. We will have some opportunities to share, and we ask that each of you review these standards to guide your comments, your stories, and our collective interactions. We will have 2 small breakout groups of approximately 6 people that are unfacilitated. And in these conversations, we ask that you mind these standards. And in particular, if you hear something that bothers you or accidentally say something that you wish you could take back, use the oops, ouch. And as you can see, we have a large group. So we're going to rely on each of you to ensure that mute or unmute is used at the appropriate times and that appropriate images are shown on video. We recommend that you use the speaker view in Zoom to see presenters along with the presentation. Next slide, please. Our overarching purpose is to identify solutions to increase equity in HCBS and identify community-driven solutions geared in particular toward greater awareness and enrollment. Next slide, please. There are multiple components to this project. Part one was an internal analysis and equity study conducted by the department, which you will hear about next. Part two was an agency, provider, member, and caregiver survey conducted by our team with nearly 500 statewide responses, which you'll hear more about shortly as well. And part three will be conversations with you through the summit today, a second summit in June, as well as conversations over the next 2 months with grassroots community organizations. Community organizations that conduct health-related resource navigation are critical in broadening awareness for underrepresented Coloradans. They're the ones with relationships, in-depth knowledge of their communities, and with the ability to be that last mile connection between people and systems. And so we will really be conducting some in-depth conversations with them. Next slide, please. So again, today's conversation is going to be an opportunity to share our findings and further identify some barriers and solutions around enrollment, awareness, and utilization of HCBS programs. Again, we recognize we have a very large and very diverse group. So some of this information may or may not be new or surprising to you. It may or may not be new or surprising to others. So we ask that you share from your experience and inquire about the experience of others. Next slide. Just a brief agenda. We will have a mix of sharing and hearing, but at this point, I'm going to turn it over to Bonnie Silva, who's going to take us through a presentation of some of HCPF's findings. Thank you.
Great. Thank you so much, Jack. And again, good afternoon, everyone. I am so excited that so many of you have signed up for this engagement. It really leaves me hopeful about the level of community engagement that we're going to get on this really, really important project. So I see some of the names on this call, and I know that many of you have deep, deep expertise in long-term services and supports, but I also see some brand new names. And the goal here, of course, is to leverage that deep expertise and to bring new people to the table. So if we get it right, we're going to have people in this engagement that the long-term care world is perhaps newer to them. And so before we dive into some of our findings and our analysis, I want to make sure that we all have the same foundation of what home and community-based services is, or HCBS. I will try really hard not to speak in acronyms, and how it can impact people's lives. If you can go to the next slide, please. So we're going to play a quick video here because people can tell their story so much better than I can. Our goal is always to center people and members in the center of sort of our work. And so as we get started, here's this short video about Vance and his family and the support that they have received from Health First Colorado, HCPF, Medicaid. We like to have multiple names. So if we can play this video, please.
Jen, it looks like the audio is not coming through for us. You might need to stop sharing and then reshare and click share sound before you go back to sharing.
And in the meantime, those of you who have not had an opportunity to share a little bit about who you are, where you are, we invite you again to do that in the meeting chat. It's really great to read through some of the stories and descriptions of who you are. Gives us a sense of who's in the room. We see there's 123 participants, but to have some color as to who those folks are is really exciting.
I'm sorry, Jack, I'm not finding share sound for me. Oh, I found it. Okay. Trying again. Sorry about that, folks.
He's been through so much, and he doesn't even know it. Hold you. Vance needs this, Vance needs that. I would write stuff down and take a guesstimate on how much it would be. And I never actually added it up because it just started going on and on and on and on, and it scared the heck out of me. He's precious. I wouldn't have him any other way. Knowing that Vance could be taken away from me, honestly, because I couldn't provide for him what he needed. But the thought of that actually, like, it went through my head several times. And it was like, oh, there's something that can cover stuff. It's great. Good one. And now, because of Health First and being able to go through his clinic, Vance he has the potential to live an everyday life just like anybody else. Straight silly. Health First has enabled us to have a life. I have dreams and goals for Vance now. I just really want Vance to be happy and kind and live a fulfilling life. And be a good person. Be a complete person. Good job. Bravo. They've made our life.
Great. That's just a short impact story of, how powerful it can be when we connect people to really life-changing services for which they're eligible. And as you will hear about in our coming presentation and engagement, our goal here is to really make sure that all people in Colorado who are eligible for long-term care services know about them and have access to them. So if we can go to the next slide, please. And again, my goal here is to provide some foundational information. One of the most important choices that any of us make is where and how we want to live. And so our goal is to make sure that for people with disabilities and older adults, that they are offered quality options across the continuum of care. So when we look at how home and community-based services, long-term care are provided in Colorado, we really have three primary buckets that those services fall into. So first, we have community-based services where people have options in their homes and in their communities. This may include services such as helping a person shower or dress for the day. It also may include services such as a day program where people can go to maybe stay engaged or connect with their communities, or perhaps supported employment services to help somebody maintain gainful employment. And then for individuals who are over 55, they may qualify to take advantage or enroll into our program for all-inclusive care for the elderly. This is a Medicare, Medicaid funded program that really provides wraparound supports to people. So provides for both their physical, behavioral health, and long-term care needs for people who are enrolled in those programs. And certainly, finally, for those who want it, we offer institutional options. And this includes nursing facilities and intermediate care facilities. We also have a hospital backup program for people with really, really high medical needs. So that we can make sure for those that really need that high level, intensive 24/7 support, that we also have that available. I think it's also important to note that when somebody qualifies for one of our long-term care programs, they also get access to all of the medical benefits that are available in Medicaid. And as you heard about in that video, that also that is often really, I think, powerful and important for our members. Next slide, please. So this slide provides a detailed overview of the enrollment and programs that serve the over 82,000 members with disabilities this previous fiscal year. Our biggest bucket is our home and community-based waiver programs. They currently serve over 51,000 people with disabilities. And then we have 2 general fund only programs. These are programs for people with disabilities who clearly need a good bit of support to remain successful, but maybe don't qualify for the federally funded long-term care programs. So we have been able to work with our legislature to get funding through Colorado's general fund to provide some additional supports for those people. Those general fund only programs are specific for people with intellectual and developmental disabilities. And then we have nearly 12,500 people who have received services through our facility-based programs. Those are our nursing facilities and intermediate care facilities. And we have over 5,700 members who are currently receiving services through PACE. And then most recently, the Office of Community Living took over the management of our long-term home health and private duty nursing benefits. And in total, we have over 5,600 people receiving that benefit. So across all of those services, we have nearly a $4 billion budget that provides supports to really help people live a good life according to their own standards and their own terms. All right, if we can go to the next slide, please. All right, so I am going to talk a little bit about our equity study. When we have looked at making this continuum available to people, we certainly want to make sure that all individuals have access to the services for which they are eligible. So I am going to cover the specific project that we are talking about today is our ARPA 3.01 HCBS equity study. In this section, we are going to learn about goals around the equity study and the efforts underway. For those of you that are, perhaps receiving services, or maybe have family members receiving services, or maybe you're a service provider in this field, I think that for those of us that are deeply connected to this work, we have this propensity to often talk about, well, how could we make the system different, or how could we make the policy different? Those ideas they're very important. We have a lot of engagement aimed at enhancing and strengthening long-term care as a whole. But for today, I want us to really focus on the equity piece and looking at access. So if I can maybe in advance ask for your engagement in that way, I would very much appreciate it. If we can go to the next slide, please. All right, so the goal of this project really is to help us better understand who is currently accessing HCBS, where are their gaps, and how can we better target our outreach to make sure that everyone who's eligible knows about these services and can enroll. So as Jack mentioned at the beginning of the presentation, we have 3 phases to this project. The first phase was the internal data analysis. This was really to identify disparities in HCBS by analyzing our Colorado Medicaid data and concurrently conducting a literature review. Based off this analysis, our staff are developing a report that identifies disparities across the system. The report will detail findings from internal data analysis and the literature review, and it will be published later this review. So that is in process. The second is the external stakeholder feedback and recommendations. So the project team is conducting the stakeholder engagement, which we will detail a little bit later, and we will produce a recommendations report. And the purpose of this engagement and the recommendations is to create opportunities for the department to more fully and equitably serve members and eligible Coloradans with disabilities. And then last and perhaps most important is the implementation plan. We want the culmination of this really important work to end in an action plan. So once the recommendations are gathered, the project team will put together an implementation plan based off those recommendations so that we can begin the very important work in creating more equity in who accesses HCBS. All right, so if we can go to the next slide, please. All right, so this slide shows the compounding sort of the guiding logic for identifying compounding disparities in HCBS. So when we set out on this project, we needed some way to frame it. And so we began to think about equity in these 6 ways. So on the outermost dark blue ring, we have prevalence. And this is really the prevalence of disability among the general population and among the Medicaid population. Next, we have enrollment into HCBS programs. And then if you go again towards the center of that circle, we're looking at what is enrollment into specific waiver 1915C HCBS waiver programs look like. So the slide I just showed you about 2 slides ago, where we had 51,000 people, we have 10 programs within that 51,000. So we're looking at each of those 10 programs and saying, what does enrollment look like? And then within each of those programs, we have a menu of services that might be available. So then we looked at what is the amount of services that are authorized for people on those waivers. And then we took it down even at a more granular level and looked at, okay, what was authorized, but then what was actually utilized by people. And then finally, we want to look at outcomes. Are people satisfied with the services? Are they getting the care that they need? And when you see disparities in the outer ring, so looking at, they compound on each other as you move towards the inner ring. So for example, if we know that a certain group is underrepresented in the enrollment into HCBS category, we know then that that particular group is not going to be using the services to support them. We can go to the next slide, please. So next, the team looked at disability prevalence in Colorado. So what this graphic shows is that the prevalence of disability in Colorado as defined by the US Census. So the US Census asks respondents to self-report disability in 6 categories. They ask respondents to identify if they have a hearing difficulty, so are they deaf or having a serious difficulty in hearing? If they have a vision difficulty defined as being blind or having a serious difficulty seeing, even when wearing eyeglasses. Cognitive difficulty because of a physical, mental, or emotional problem, having difficulty remembering, concentrating, or making decisions. If they have an ambulatory difficulty, this is defined as having serious difficulty walking or climbing stairs, a self-care difficulty, which is defined as having difficulty bathing or dressing, and then finally, independent living difficulty. And they define this as because of a physical, mental, or emotional problem, having difficulty doing errands alone, such as visiting a doctor's office or shopping. So respondents who report in any one of these 6 disability types are considered to have a disability. It's important to note that prevalence is not the same as disability severity, which is used to determine eligibility for HCBS. So just to drive that point home. So this gives us a great general idea of what is the prevalence of disability within the broad community. To be eligible for Medicaid, home and community-based services, somebody has to have a disability that has a much greater severity. So it's not 1-in-1 the same, but nonetheless, we would expect to see a higher representation in home and community-based services for Black and American Indian and Alaska Native members in particular, based off of this data. In older adults, Native Hawaiian and other Pacific Islanders, though they're a smaller population, also have higher rates of disabilities, as well as the Hispanic and Latino older adults. And what this data shows us is that whites tend to have less prevalence across all age groups. So when comparing this to who is accessing long-term care, we can use this as a bar to identify where we might have gaps in access, where we may have an equity issue. If we can go to the next slide, please.
Bonnie, for interpretation, if you could adjust the pace just a little bit slower, that
Yes.
would assist the interpreter. Thank you.
You bet. Thank you for letting me know. I have a really hard time presenting and monitoring the chat. So if anybody needs me to do anything, thank you for interrupting me, Jack. It's very helpful. So on this slide, we have American Indian, Black and Hispanic, Latino children with disabilities represented. What you can see is they are underrepresented in home and community-based services, or HCBS. So for children, the disparities show up in the American Indian, Black and Hispanic and Latino populations. We then compared this data to the home and community-based services enrollment to the overall Medicaid enrollment rather than just the overall state population to try to better capture who might be eligible. As we tend to see lower income people of color, thus higher eligibility rates for Medicaid. If we can go to the next slide, please. So what you can see here is for adults, American Indian and Hispanic, Latino in particular, are underrepresented in home and community-based services, or HCBS. When we look at the disability prevalence and enrollment trends for overall Medicaid population, we would expect to see more representation in home and community-based services, especially in the Hispanic and Latino populations. Next slide, please. So this slide provides a visual representation for the guiding logic for identifying those compounding disparities in HCBS and allows us to identify where do we need to have our focus area. When we see disparities along the continuum of awareness, access, and utilization, we know that the biggest disparity from our internal analysis is in the representation in home and community-based service programs. This means that either people are not aware of or not enrolling in these programs. People of color, and especially Hispanic or Latino folks, are underrepresented across the board in all HCBS programs. With this information, the ARPA 3.01 project focus has become to focus on boosting enrollment among these programs for those populations. Today, we will talk about some of the barriers and solutions for boosting enrollment, but please know that there is much work going on. The 63 projects that I talked about at the beginning of this section to enhance the home and community-based services in Colorado, including using an equity lens as we implement each and every single one of those projects, making our entire system more equitable to everyone. This is my attempt to get you all to focus on this particular project during our next hour and a half. So we want to make sure that we focus on this project and that the moment in time that we're making sure that people who are eligible for these programs are aware of them and supported in accessing these services, which are pretty robust. I know that many of you on this call have worked tirelessly, words are hard today, for many years to get us to a place where our programs are upheld across the nation as a model. So thank you for your work. Thank you for your efforts to continuously improve our programs. But today we are going to focus on not necessarily how to enhance our programs, but you will hear from Civic Consulting Collaborative about the approach we are taking to develop and deepen relationships with community groups and connectors to help bridge the gap and reach folks who could benefit from these amazing programs that we already have, while also understanding what we can do to better support people and becoming just aware of the programs in general. This is just one step in our journey in creating more equity in HCBS. We hope that our efforts here will yield a more equitable representation across HCBS, but we know that there is other work to do to make sure that all of the services are culturally competent and that people are receiving support in a way that works best for them. So this is our commitment. We will not stop here. This is our starting point. We will continue to analyze how we can create equity across the system, and we are grateful that you are here and that you are supportive of this work. Now, if there is no questions for me, I'm going to transition it back to Civic Consulting to talk more about our engagement plan and get us set up to have some discussion.
Great, thank you so much, Bonnie. If we can go to the next slide. I believe we've got a moment just briefly. If anyone has a question to clarify any of what you just heard, we'd love to have you drop it in the chat before we send you all to discuss what you just learned about the equity study together in breakout rooms. So you can feel free to drop those questions in the chat, but I will explain in the meantime. So you just heard a lot from Bonnie and the team at HCPF, and we are now going to ask you all to discuss your unique perspectives on navigating the system together. Whether we know that you all got unique perspectives, and whether that's because you're geographically where you are geographically, how you support these services, or what your needs are, our hope is that you can all share your perspectives with one another to identify what works in breaking down barriers to accessing HCBS. So to do that, we are going to send you into breakout rooms in just a moment until 12:55. You'll be assigned randomly a room with 4 to 6 other people per breakout room, where we'd like you to discuss this question that you're seeing on the screen. What have you seen work to break down the barriers to accessing HCBS and navigating the system? Please keep the standards for inclusion and care in mind, and make sure that everyone has a chance to speak who wants to speak. And in the last 5 minutes of your discussion, we're gonna send out a broadcast message that you'll see appear in your breakout screen that will let everyone know that it's time to shift to summarizing the key ideas of how you can break down barriers in these navigating these systems from your breakout discussion to the rest of us, so we can report back. So we want to have you all choose one person at the about 12:50 mark who can enter your summarized ideas into a tool that we are about to drop into the chat called Easy Retro. And if you can go to the next slide, please. So this is the tool, Easy Retro, that you will see that we want to have you use to share out your ideas. And this is the link that's going in the chat now. You should be able to click that. It is turned off right now. You cannot actually add anything until the 12:50 mark, when we actually open up for responses. But if we want to give you this tutorial to just show you that if you click the plus button there in the middle, that will let you add a new card that looks like the little pink squares down there at the bottom. You will see that you can type something in that white box, and then you're going to make sure that is where we're going to ask you to drop the answers that are summarized from your breakout rooms. You will be able to create a card and then save it. It's very important to please click save so that others can see your cards during the report out. Please only list one idea per card, but you're welcome to share as many ideas as you want that come out of your breakout room discussions. Submissions are anonymous by default, but if you'd like your name associated with the cards you submit, you can use the button up there, the blue one, to do so. Again, remember, you won't be able to use or add cards to this board until the 12:50 mark, when you see that broadcast message saying that things have been opened up. And then we just want a summary of the ideas your group discussed, not every single idea, and one idea per card. We'd ask you to just have one person who feels comfortable kind of typing out some of the best ideas that come out. Your breakout rooms will not be recorded by Zoom, and if our team and HCPF will not be joining the groups. However, we will be here in the main room, so if you have any questions or issues, you can come back to the main room and ask them by clicking the leave room but not leave meeting button that will appear in the bottom right. So that's how we're going to report out from the discussions. But first, the discussions. We're going to give you a few minutes, send people to breakouts now, and you will be randomly assigned in just a moment. Please introduce yourselves quickly and talk about what you have seen work to break down barriers in accessing HCBS or navigating the system.
Great. I'm going to send you into your breakout groups. Please do stick around. The second half of the meeting, we'll be going over the results of our survey, which many of you completed. Okay. Rooms are open. You can join those now.
Whoever's doing the recording now could be a good time to pause it, because otherwise you'll just have a few minutes of us in the quiet.
Groups. Thank you, Jen. As we come into a debrief period, I'd ask Rashawn to put the link to this back into the chat. So if anyone needs to grab the link, you can take the next 60 seconds or the whole period while we're talking to add in any additional points that you'd like to share. But I think at this point, I would invite someone to come off mute and share an experience or share a little bit about their conversation. Would someone like to?
This is Todd from Breakout Room 14.
Hi, go ahead.
Yeah, we talked a lot about the different barriers as far as just eligibility determination and professionals that are involved in the system having correct information, or like I said in our breakout session, I feel comfortable enough to say, I don't know, and I'll look it up rather than give them offshoot of what they're trying to find out and it proves to be totally wrong. Also, some of the limitations on the HCBS approvals themselves and the SSI determinations. Thank you.
Thank you. If there are other folks that would like to share, perhaps you could either raise your hand or indicate in the chat, and I can call on a few folks. Invite someone else to come off mute and share about their conversation or about their experience of what they've seen work to break down barriers.
Jack, one of the things we talked about in breakout room 11, and we talked about a couple of things, but one of them, once people get into the HCBS service system, one of the things that we've started to see that works more in people's favor is the removal of some of the artificial unit utilization caps that have been put in place for a number of years. What works for many does not work for all. And so what some of these caps have done is artificially limited how people can prioritize their needs and the services they get. And as we're starting to see some of these caps removed, people really are becoming more in control of identifying the services that they want to prioritize for themselves.
Thank you, Christy. How about others? Would invite you to share about what you have seen work to break down barriers to accessing HCBS and navigating the system.
Okay, hello, can you hear me?
Yes, go ahead, Gina.
Yes, and so what my group, we talked about some of the things that broke barriers is community organizations, different parent organizations reaching out to the community. That has helped break barriers. And then also, one of my group members mentioned just putting things in layman's terms, so that people can understand, because, some people don't understand what an HCBS waiver is, or even, so they can see that and how useful it is, just being able to break down even some of the language for people.
Thank you, Gina. And one of the things that you all will see in the Easy Retro board here is the ability to sort of like, that's the thumbs up, or to comment directly on another card. And so during our debrief now, later, and afterwards, please feel free to do so. We're really using this as a learning tool for the rest of the project, for us to really deepen and enrich our understanding of what's working, what the barriers are, and where we need to ask more and learn more about as we have conversations, especially with grassroots community groups. We have time for another one or two people to come off mute and share about their experience.
This is Deanne Major. So I think it's helpful when we talk about community organizations that we also make sure that we're including adult protective services, because so often they are seeing those people in crisis that are struggling, and sometimes APS caseworkers seem familiar with these HCBS programs, and sometimes they don't. So they don't seem to access them or have the proper knowledge of them. And so I think pulling them into the arena of being in this conversation as well is very important. Sometimes they screen out individuals, but oftentimes they do work with people and making those community connections.
Thank you so much.
And Jack, it looks like we've got a couple comments just to lift up here in the chat. That Trevor said that their breakout group room talked about utilizing community organizations and resources that are already in different communities to help provide information and connection to individuals who are eligible. And Chantel said that we all learn about services from each other, talking about not having to know someone who's engaged in the field to get info, and that she serves with a group of parents who all call each other when one of their 25-year-old adult children with disabilities comes off the waiting list, because if you miss the message or don't get it, they move on to the next person waiting. So this group of parents is all looking out for each other. That's helped break down barriers.
Thank you, Rashawn. One of the comments that I see in the Easy Retro board that seems to be getting a little attention is around barriers for language access. And this comment says some barriers discussed that focus on language access in plain language. And the HCPF website, while much improved, is geared to more educated professionals. And so would love to see plain language, 5th grade or below, in English and other languages. Would someone like to come off mute and just give us any additional context or experience that you have around language access for materials? That's something in particular that we're going to be spending a lot of time on over the next year and a half.
Yeah, so that was kind of in our group that we kind of talked about it a bit. And I think culturally, we don't, I mean, a lot of organizations do this. Don't think about the fact that education level does make a difference in how you present information to people. And so someone in the chat in our group mentioned that someone would just send a family to HCPF. And I said, I would never do that. I mean, none of my families with their education levels that I work with, which are mostly Medicaid, would not be able to understand the site. So I typically plain language it for them in Spanish to get them the information, and then, direct to where they need to go, etc., or help them facilitate that. Whereas if the website had better language. And it's not that some areas aren't translated. The problem is that the translation is basically word for word English. Well, if you are at an education level that's higher and then you translate it, you're just translating word for word, not actually what it means. So that's where I was kind of, we were kind of talking about in that group.
Thank you, Jeanette.
And that's
Appreciate
across the board, all organizations. I also work for Association of University Centers in Maryland, and that's one of the biggest issues that comes out from our families all across, doesn't matter what state, is it's not broken down in a language that they can understand.
Thank you, Jeanette.
Mm-hmm.
Well, thank you all for participating in this this first round of discussion and debrief. We're going to have another round after we now go through our provider survey. I get the sense that many of you participated in that. That was a short survey that we did in February. And so now I'm going to introduce my colleague, Amy, and Jen, ask that you switch back over to the PowerPoint as we go through this next portion.
Great.
Amy?
Yeah, thanks, Jack. I get to share with you all the findings from the agency provider member and caregiver survey that many of you probably took some time out of your day to participate in. So thank you very, very much for really participating in this really important effort, both through the survey and today. So the purpose of the survey was really to learn about barriers, about learning about home and community-based services, enrolling in those services, and utilizing those services. So as I share the findings from that survey, please feel free to continue to use the chat and the reaction features in Zoom to share your questions, comments, and reactions. My team will continue to monitor the chat, and hopefully we'll be able to address any questions as fluidly as possible. So here we go. All right, so the first question on about a 15-question survey really aimed to help identify who respondents were within their Medicaid HCBS system, home community-based services system. So either a person provided services and supports to members, potential members, and their families, or they were a member themselves, or they care for a member, a Medicaid member. So depending on which bucket folks identified with, they got a slightly modified survey with about 15 questions. Like Jack said, the survey was sent out through the Office of Community Living Stakeholders newsletter at the end of January through the end of February. And it was sent out in both English and Spanish, but there were no Spanish responses. So who did respond? Next slide will show us a little bit about the 485 survey respondents that did participate. So the blue pins in this map represent the locations of the 349 agency and provider respondents. So every county was represented by regional or a county serving organization, except for Cheyenne. However, they were represented through the 30 respondents who provide statewide services. Okay, the green houses on this map represent the 136 member and caregiver respondents who resided in 17 different counties across the state. Okay, so who identified as agencies and providers? Next slide. As you'll see, folks who represented this portion of the respondents really fell largely in the case management agency provider type, with over 40% in that kind of bucket. The next largest contingency, beside those who chose not to respond, represented program approved service agencies, or PASAs. So obviously, next slide, we obviously did not ask members and caregivers about their organization type. Instead, we asked a little bit about their identities. So the vast majority of member and caregiver respondents identified as white, and again, a significant number chose not to respond. 11 participants responded as yes or unsure to identifying with the queer community. So when we're looking at the rest of these member findings, please keep in mind that they largely reflect the experience of people who identify as white, straight, and cisgender. On the next slide, we start getting into some of the findings. So this chart illustrates the common ways providers hear that members learn about home and community-based services. And those most commonly identified by providers were a family member or friend, a community-centered board, a human or social service agency, a single entry point, an agency, and medical providers. On the next slide, we'll see how members reported becoming aware of home and community-based services. So members and caregivers themselves shared that a community-centered board is indeed how they become aware of HCBS, but also a disability and community organization, and then also family members and friends. So you won't see a human and social service agencies, single entry points, or medical providers as some of the most common ways folks, members reported being connected to or becoming aware of home and community-based services. But they did really identify the disability and community organizations. All right, so the next slide shows what some of the barriers providers see as members encountering with, cool, thank you, with home and community-based services and becoming aware of this program. So the most common barriers that providers think or see members have in learning about home and community-based services are not knowing where to find the information about the program, the materials being confusing, mistrust of the system and providers, and not wanting outsiders in their home. On the next slide, we'll see what members reported as barriers to learning about home and community-based services. The most common was really never hearing about it, not knowing where to find information, materials being confusing, and materials not providing enough or the right information. So quite similar to what providers reported, but with the exception of not wanting strangers in their home. However, these folks are obviously engaged in the program by completing this survey. So maybe those aren't the folks that are concerned about that. Okay, so on the next slide, we have a couple of quotes from respondents about how these barriers impacted members' experience. And so one member described the lack of awareness broadly as not enough people who serve and support people with disabilities know that HCBS is available and how it can help children and adults with disabilities. There have been so many times schools had no idea, therapists had no idea, hospitals had no idea, etc. There are so many missed opportunities to educate the community about HCBS. And a provider described this similarly in recognizing that this is the case even when families are involved through early intervention. And then, of course, as you guys have mentioned already as well, people definitely spoke to how the website is very difficult to navigate. Okay, on the next slide, we'll be starting to look at enrollment. So some of the common barriers providers identified as that members experience with enrollment are finding the right entity to start the process with, documents, the document requirements, and wait lists. So on the next slide, we'll now see what members identified as the common barriers for enrollment. And you'll see it's actually quite similar with to what the providers reported, but also that it just takes too much time. So on the next slide, again, we'll see a couple of quotes from respondents about these barriers, and really the description of how there's just a ton of misinformation, how confusing it is, how complex the system is, and how there's really just a lack of transparency and communication during the process. So one member shared, I have experienced a lot of misinformation, confusion from nearly everyone. The system is very complex and it's difficult for even providers or myself, someone who has been in the system for years. And again, a provider also shared their perspective about this, saying case managers are not well trained and provided inaccurate information leading to service issues, provider issues, and distrust of the system. This has become so problematic that PASAs now have to train their staff on what should be the case manager's job. So on the next slide, we specifically looked at the consumer-directed programs, CDAS and IHSS, and what the barriers are around knowing about these two consumer-directed programs. And from the provider's perspective, the barriers include the inability to manage the services, the members' inability to manage those services, the lack of knowledge about these programs, the certification requirements, and reimbursement limitations. On the next slide, we have what the members identified as barriers to these two consumer-directed programs. That included providers lacking or withholding information about the program, not being eligible for these services, not knowing about them, and reimbursement, staffing, and management issues. So just to note, we did not offer the response of providers withholding information. However, a number of people described that as their perception as to why providers didn't share the information. Okay, so on to the next slide, which begins to start to identify some solutions. So we asked about solutions specific to increasing awareness of home and community-based services. And those fell into basically 4 buckets. And so the next 2 slides summarize those. So the first major area was around education and training of case management agencies, particularly intake case managers. And then also increasing funding to include outreach, education, and more involved navigation support. The second major area was around improving materials and communication about home and community-based services, including standardizing materials across the state, using more accessible language, translating all materials and forms into at least Spanish, and using a variety of mediums and strategies to get the information directly out to people. On the next slide, we have the third major area, which was around outreach and access and making sure the website is user-friendly, as you guys have described already, and that the program is easily accessible through common applications and websites, in addition to being a part of outreach materials after individuals receive specific diagnoses or enrollment in specific benefit programs. Okay, the fourth area was actually the most commonly suggested and is around expanding the network of people who are aware of home and community-based services and are able to support people in starting the enrollment process. So respondents thought that educating people in the broad sense of the disability community about home and community-based services would be extremely beneficial. So these folks included, it's a long list, primary care providers, hospitals, schools, aging communities, libraries, human services, health departments, criminal justice system, community mental health, vocational rehab, and immigrant and cultural and religious organizations. So, and I'm sure that is not exhaustive, but just to be clear that we're talking about the broad, the broad community and where folks with disabilities interact. So this major area of focus for solutions is where we'd like you to spend the next chunk of your discussion time. So the next slide shares the discussion question we would like you to focus on in small groups again. So the question is, what would community navigators or just folks who interact with the community, like I just listed, need to know and be able to do to consistently give effective, warm handoffs to potential home and community-based service members to the appropriate case management agency? So, we're going to follow the same kind of process for these breakout groups. Please keep in mind the norms for inclusion and care and allowing everyone to have an opportunity to share. Around 1:35, we'll again open up those boards for the last 5 minutes of your discussion, and we'll send out a reminder to have you kind of summarize those key ideas that you discussed in the group. Let's see, Rashawn already put the link into the chat for your reference. Remember that only one person needs to deal with the technology of Easy Retro. And the rest of you hopefully will just be able to enjoy the discussion together. And putting your heads together about what the critical information folks within the community need to know and be able to do to provide effective, warm handoffs. We'll reconvene at 1:40-ish to debrief together. Any questions? I haven't seen much come up in the chat. If there's, I know that was a ton, so we can start with questions if there are any after the discussion. So Jack and Jen, are y'all ready to send folks to breakout rooms? All right, enjoy your discussion. We'll see you in a few. Thanks, y'all.
Thank you, Jen. Thank you. I hope you had good breakout groups. The Easy Retro board is live. Looks like some comments have come in. Those are the comments in blue. And again, you use the plus sign to create a new card and tell us something. And then click save. And if you'd like to add your name, then that is also a way to have your cards not be anonymous, but that is completely up to you. And then I would encourage you now to be reviewing those and clicking that thumbs up like button. That can help us during facilitation, as well as commenting directly on cards using that sort of little circle function again. And Rashawn, if you could share the link to the Easy Retro one more time in the chat, that would be great. So as we get into it, I'm actually going to launch a quick poll. This is just a 1-question poll. Can you see that? Is that showing on the screen? Great. Going to give folks just a few seconds to fill that out. Did you learn anything from the presentation findings? Okay. So a little bit of a mix. It looks like a lot of what we shared with you today, to some extent, you already knew about, maybe confirmed a little bit of what you knew. Hopefully, that it was good to see also means that you gained a little bit of extra context. And that's partly what this debrief is for us to really share experience and additional context. So I guess I see right off the bat, the first question here that's getting some attention needs some parsing / education on how Medicaid interacts with LTC. Don't need to be an expert, just know that something could be helpful and who to contact. Would someone like to share a little bit more about that conversation or that comment? Feel free to come off mute.
Sure. This is Trevor McKinney. This was in our breakout room. We talked a little bit about this, and having to explain to individuals, families, community members, and I'll clarify too, this is from a largely case management perspective, but we wanted to kind of talk a little bit about how there isn't a lot of education in the community about the difference between Medicaid versus long-term care, and just having the ability to kind of point people in the right direction of this is who you call for a need like this versus a need like this, and just a basic understanding of like what is Medicaid versus what is long-term care could be really helpful. And then just adding to that of like who to contact, we point folks in the right direction, and then those subject matter experts can kind of take it from there.
Thank you, Trevor. So yeah, there's a lot to, a lot of decisions that one has to make when making a referral is partly what I heard there. And so thinking through how we can ensure people have the right information, the right maybe look-fors, and help sort of ease that decision-making so people get to the right place is critical. Thank you. I see some comments are still coming in. I'd encourage you to continue doing that. Would someone else like to come off mute and share about any of the conversations that you had?
We talked a little bit about when people are transitioning from adolescence to adulthood, there's not a formalized process to screen people to see if they need services or not through the school system or some other fashion. And so some people just leave without, enter into adulthood without knowing that there's things there. And it'd be nice to have something kind of formalized.
Thank you. Others that would like to share? really helpful for us to hear a little bit more about your ideas and your conversations. About this comment around a central location for information on programs that is easily navigable and has language that is easy to understand. What might that look like? How would that help a community navigator get someone to the right place?
Hi, my name is Zephrine. I apologize I couldn't get in on the group. I'm multitasking with 3 kids at home today. So first of all, thank you everyone. This is super helpful. I do have teenage children who will be adults in 3 years, so I'm very concerned in the best way to navigate this. But as a parent, getting the information has been the hardest, and a place where I often stumble upon information is the library. And for whatever reason, I find that parents who know to be actively engaged or caregivers in their client or their child's life seems to find information there. So even on, and I didn't even know this, we homeschool, I went to DPS's website and they have a whole deep down in there, like a special needs link for several resources that you can find, but like, I mean, I had a deep dive to find this link. And so maybe if it was like, even if it was on the websites of somewhere like Rocky Mountain Services or Developmental Pathways, I heard one of the, I believe, caregivers talk about how it's like hard to know where to direct families. It's also as a family, like, where do I actually go? Like I said, we are actively navigating, you know, a child who has Medicaid and 2 children who have family support services. And I have been doing this for 11 plus years. Our oldest will be 15, and I still get really, really confused. So I just think that even the information being in places that are viewed as maybe community spots would be helpful.
Thank you for sharing your experience. Certainly one of the things that we found in the survey that Amy talked about was many members and caregivers really pointed to getting information from trusted and sort of community sources, similar to what you just shared, like a school, but also Facebook, family, friends, a community center, not necessarily a professional location or person that works with people with disabilities or as a provider. So that is certainly something that we are asking more questions about and we want to know more about. So thank you. I think we have time for one more person to share. If there's someone that would like to come off mute. Okay, usually I can wait out a crowd, but I know that we've been going for a while. So Jen, I'll ask you to go back to the PowerPoint and go to slide 46. Thank you. So thank you all for sticking with us, for joining, and for your participation today. And of course, we know that you are the members, the caregivers, the advocates, providers, the agency reps that make the system work for tens of thousands of Coloradans. So over the next couple months, our team will be conducting learning exchanges with health and resource navigation organizations across the state of Colorado. So please know that what you shared with us today, what we learned today, we're going to anonymize, and we're going to carry those learnings with us forward on the project and in those meetings as we continue to learn how to reduce equity, how to increase equity, reduce inequities in the system. We'll also be starting a project to transcreate HCBS member-focused materials, working directly with community resource navigators and members in that creation process. That's something we heard about today, the need to have usable materials, understandable materials, helpful materials. That is squarely on our radar. There are resources around it, and look for more information about that over the next year and in the near term. We're going to leave the Easy Retro board open for the next 48 hours, and we hope that you will add your ideas, comment and like what's in there, because again, that's a key piece of what we're learning and taking with us. So I'm going to turn it over to Bonnie Silva to close us out. And again, thank you so much from CREA Results and the Civic Consulting Collaborative team.
Great. Thank you so much, Jack. We really want to make sure that we hear your feedback around how the engagement went today. It's important to us that we are designing and leading engagements that are meaningfully and accessible to you. So can you just give me 60 seconds of your time? If you can click on this link, you can also use the QR code, literally 60 seconds of your time, and let us know how we did and certainly how we could do better. Again, this is our starting point, not our ending point, and we want to make sure that we are engaging in ways that make the most sense for the community that is showing up to help us do this work. If we can go to the next slide, please. We ask that you stay engaged. We have a lot of work underway. We really appreciate your insight specific to how we can increase equity in our HCBS programs here in Colorado. It is undoubtedly will make us better and help us improve access and eligibility processes to these really life-changing programs. Back to the survey slide, please. Of course, we can, Dee. Appreciate you doing the survey. I got a little happy. I'm just going to give a preview while you guys are doing the survey of what's on the next slide in terms of staying engaged. We'd like to end each of our webinars with a series of links that people can go to and get access to more information. We have an extraordinary amount of engagement happening around ARPA, but also within the Office of Community Living. And I appreciate that you chose to spend the last 2 hours here with us. Oh, it's not connecting to the survey is what I see. Rashawn, can I maybe get some technical assistance?
Yeah, I was just about to say it's working for me. So Todd, I wonder if you need to just copy and paste that into your browser.
Oh, good. Good pro tip. So Todd, maybe try that.
That's a good idea. Thank you very much. Sorry about that.
All right, so just to forecast for people, we will wrap up our report and our engagement by the end of summer 2023, and then move on into an implementation timeline. So certainly stay tuned for next steps on this work. If you're interested, you have all the links right here. We have our stakeholder engagement calendar. We have our ARPA webpage. If you're not subscribed to our newsletter, I feel like a YouTuber every time I say that. I promise there's no paid affiliations there, but we try really hard to condense what is an extraordinary amount of information into easily readable, palatable, bite size. So I encourage you to sign up for our newsletter. And then we try to have key information on our OCL webinar page specifically. So these links I hope are helpful to you, and you can use them as you figure out how to engage with us as we move forward. I'd like to thank the entire team that put so much effort into this webinar. I really that from the data presentation to the thoughtful sort of breakout strategies, we really wanted to create space to get your insight. And we look forward to connecting with you further on this important work as we take your feedback, incorporate that into our action plans, and engage with you further. So thank you all. Have a wonderful day. Appreciate your time.